Hey y'all, it's Gabrielle Cottrell coming back to you about some great helpful information. So I'm very excited to be with you all again. So again, my name is Gabrielle Cottrell. I am a licensed pharmacist and graduated from Auburn University or the Harrison School of Pharmacy. So excited about that. But anyways, I did want to do a follow-up video. I don't know if you all saw the initial video with we had Tamara, our physician assistant, come on to do like a whole big overview of hypertension or high blood pressure, what it is, the risk factors. We did an overview of therapy and how do you help lower your blood pressure and all that stuff like that. So we did that like, I want to say 2 weeks ago. So if you haven't seen it, please go back and watch it. It was very good. Kind of long, but it was good though. So today I just want to do a follow-up again about lifestyle changes that you can do to hopefully lower your blood pressure. So yeah, just to do a disclaimer at first, because I do like to start that out with a disclaimer. I am a licensed pharmacist. I am, I do consult patients on my job and everything like that, but I am not your pharmacist. I am not your primary care provider. So I will ask y'all to please follow up with your healthcare provider or your doctor or your nurse or whoever is helping you with your any of your ailments or conditions or diseases, to please follow up with them if you have any, or if you learned any really good information here, you want to take it back to them and say, hey, like, what did you think about this, or anything like that, to help better your treatment and better your therapy. So I just don't want you to, treat yourself according to what I tell you here today. Please follow up with your provider, like, for real. Anyways, we're gonna jump into it. So again, we're going to be talking about lifestyle changes that you can do to help lower your blood pressure today. Now, this will include different things that are not associated with like medications. So what we're going to discuss today, we're going to talk about nutrients that can help lower your blood pressure. We're going to talk about food and lifestyle. And then we're going to talk about exercising. So those are our 3 topics that we're going to talk about today. So let's jump into it, right? All right, so our first one is nutrients. Now this one, I don't know if a lot of people know about, but there's certain nutrients or there's certain electrolytes and things like that that are in your body that can actually affect your blood pressure. So looking at your electrolytes, if you get your lab work, like normally I know a lot of our patients, they get their labs taken. So they get their blood drawn and their doctor looks at like their renal clearance. They look at their electrolytes, like their potassium, their magnesium, calcium levels, all that stuff like that. They have like a long sheet and it tells them reports on it. And that really gives the doctor understanding of what's going on in your body. So looking at blood pressure, sometimes people can have high blood pressure if their calcium, their magnesium, or their potassium is deficient or is lower than normal. So if you do get your lab reports back, ask your doctor and say like, hey, how is my calcium level? How is my potassium level? How is my magnesium level? Because if it's lower than normal, then sometimes that can actually increase or have an effect on your blood pressure level. Another thing is some nutrients that can, like supplements, or supplements that can actually help or aid in high blood pressure. And so this is garlic. One of them is garlic. Now this seems like it's like an old time remedy, but there's garlic capsules that they have now that can actually, and they say that this can actually help lower your blood pressure. Also, there is an amino acid called L-arginine, and this has been associated with lowering your blood pressure as well. Then lastly, we have vitamin B complex. And I know we use vitamin B, like vitamin B6, vitamin B12, all these vitamin B, and I mean B as in boy, not D as in dog, but vitamin B, vitamin B complex has been shown to help with circulatory, like your heart circulation, and also helping to reduce the blood pressure. So that's our first thing we talked about was nutrients. So asking your doctor about your electrolytes, like your calcium, magnesium, potassium, seeing if those are out of whack, and hopefully you can ask your doctor like, hey, do you think this is somewhat correlated to my high blood pressure? Is there any way that we can do like a supplement or something like that to help with my electrolytes, to see if we can get that blood pressure lower? And then also looking into those 3 different supplements we talked about was that garlic, the L-arginine, and L-arginine is like L hyphen A-R, I think, let me look at this spelling, A-R-G-I-N-I-N-E. So L-arginine, and then also the vitamin B complex, and all of those 3 that can actually be found over the counter in like a capsule-like form. So now that we've talked about nutrients, let's head over into our food and lifestyle. So these, like the food and lifestyle, it's like really very like dear to me, because I don't struggle with high blood pressure. I just have patients that, you know, have high blood pressure, so I help them in that manner. But the food and lifestyle, now that is something that I really do for myself on a daily basis in my household. So it is something that I really try to make sure we manage well. But anyway, so jumping into the food first. So I know the American Heart Association, they always have these guidelines, and I'm sure your doctor, if you deal with high blood pressure, your doctor has said like, hey, make sure you watch out for your sodium. Like, keep your sodium intake lower. And you're like, okay, what does it mean to lower my sodium? Like, I know that's what I'm thinking, like, well, how much sodium am I supposed to have? Like, how does that look like? So according to the American Heart Association, you're only supposed to have 2,300 milligrams of sodium per day, or salt intake. So you're probably thinking, like I'm thinking, what is 2,300 milligrams? So, and so 2,300 milligrams is actually equivalent to about 1 teaspoonful of salt per day. Not a tablespoonful. 1 teaspoonful of salt per day, okay? So if you're used to, like, you know, just eating all the processed foods, all the canned veggies, all that stuff like that, the salt intake in that stuff is pretty high. So one thing that I ask, even when I look at certain things, when I purchase them, is that I always look at the nutrition label. The nutrition label is found on everything. If it's not found on that food item, don't buy it, okay? So when you're looking at it, I look at the serving size. That's the first thing I look at, is the serving size. Because some people think like, okay, this whole can is 1 serving size. Like sometimes they'll say a third or fourth of the can is this much, in like that pertains to this nutrition label. So I always look at like the serving size first to see how much milligrams of sodium is in that 1 serving size. So then I look at the sodium to see how much sodium is in it. So one thing that I've noticed when I'm going through the grocery store and I'm buying food items, I love fresh vegetables. Like, to me, I mean, this is just me, I actually think I can find fresh food items that are cheaper than like the canned and like packaged and processed stuff like that. So we tend to love to, and if you can, but we love to make our stuff from fresh, or if we buy fresh items and we can't use it right away, we freeze it. So, but yeah, anyway, so I really like to buy fresh stuff first. And then also, again, I look at that nutrition label. So when you're looking at the nutrition label, what I found is that a lot of the high sodium, like things that have high sodium in it, is really like your packaged foods and even breads, y'all. Like, so look at your bread and see, like, turn on the back and how much is 1 slice. You know, if you're making sandwiches, I don't know too many people using 1 slice of bread for a sandwich. So, you know, even like your bread has like some sodium, like has a high content of sodium. So sometimes you may want to consider switching to a different brand that has lower sodium. Or, hey, you may just feel funky and you want to make your own bread. Like, to me, making your own bread, it's like, it smells like so good in your house. I don't make my own bread, I'm not gonna lie to you. But I've done it before, and it smells so good. So if you can do that, that's awesome, because you can control how much salt you're putting in it. So the next thing I've noticed, things that have high sodium content or high salt content, is like those packaged, like the frozen packaged foods, and like those canned foods that have like all that like liquidy stuff and all that stuff in it. That stuff, I mean, again, look at your sodium. I'm not saying that you can't have it. Like some people, like that's how you live your life. It's on the go. So sometimes those things help you, but maybe you can do things in moderation. Maybe you could say, I'll have one frozen dinner and the rest I'll make it myself. Or maybe you can say, hey, I'll use these canned vegetables, but I'm gonna pour off all this juice. I'm gonna rinse it off and hopefully take some of the salt content off of it. And then I'll reflavor it myself using, you know, non-salty seasonings. You can use garlic, onion powder, pepper. Like you can, you know, spice that stuff up good with different flavors, and you don't have to include salt. But anyways, so that's really talking about food. I'm just really talking about salt on that. I'm not gonna really touch on any other food thing right now, but I will jump right into lifestyle. So one of my biggest things about lifestyle that I notice is that people's stress levels, like I don't know how it was back in the day, but right now I know with like COVID-19, the fears, like your fears are up, like people around you may be, you know, they're not there anymore. Maybe they've died, I don't know, and I'm sorry about that. But or maybe you're out of work, or maybe you're thinking about so much other stuff and your stress level is like off the rip. So my biggest thing that I've been learning is that your stress is really it's linked to the health of your body, and your stress can actually like drive your blood pressure up so high. If you hear my baby in the background, he back there playing, so this kind of like an insert, but he back there playing and laughing, so you may hear him. But anyways, back into it. So yeah, your stress levels, just please, if you can, like one thing I've learned is to control what I can control. If I can't control it, there's no need for me to get all excited or get all emotional, get all stressed out, because trust me, whatever you getting excited over, or whoever you getting excited over or stressed out about, I bet they're not studying you. Like I bet they're not losing sleep. I bet they're not crying. I bet they're not getting their blood pressure up about, you know, anything that's going on. So control what you can control. If you can't, like, do breathing exercises or talk to someone to get that off of your heart, because that stress again can drive that blood pressure up. Next thing about stress and like your health and being able to set the environment around you to help with your stress levels is they actually do this thing called color therapy. So as you know, I'm in like a green room, because like green, blue, like your soft pinks and violet colors, they're called calming colors, and they actually help reduce blood pressure. And this is actually like studies have shown that this helps. So if you're stressed out for the day, please, like if you can get into a room that's a blue color, that's like an olive green color, like a soft pink, like a subtle violet, like it'll help you reduce, just looking at it will help you reduce your blood pressure and kind of calm you down. They're called soothing colors. And if you mad or if you stress out for the day, please don't walk into a bright red room, an orange or yellow room, because these are exciting colors. These are colors that actually strike conversation and things of that nature, but they also have been linked to increasing your blood pressure. So just watch out for that. And again, like just the takeaway points for the food and lifestyle is to, watch your salt intake. Watch if you can limit it to that one little teaspoonful of salt per day. That would be awesome. Watch out for your processed foods, your canned, packaged food items. Look at that nutrition label. And then also just to follow up on our lifestyle, control what you can control. Like if you can, don't let people stress you out, because I don't know if they studying you. I don't know if they get stressed out over you. So, what is it worth? What is it worth you stressing yourself out over something you can't control? So, and again, if you can, have your house set up to a way when you walk in, or have even your work environment, wherever you walk into, make sure there's a certain, I guess what my daddy would say, a certain ambiance about it. Make sure it's peaceful when you walk into there. Maybe it's colored a certain way. Maybe you like flowers. Maybe you like music. Like I just had some Sade playing because like I like music, and so it helps calm me down. But have those little, things around you that can help soothe you and calm you down to reduce that blood pressure. So now we talked about the food and lifestyle. We're gonna go into exercising. Now, if y'all don't know, like, I ain't gonna brag on myself, but I go ham in the workout room. Like, I love working out, y'all. Like, that is my time. Like, that's my time to de-stress. That's my time to think. That's my time to be like, you know what? I'm gonna push myself today. I'm gonna be disciplined today. Like, I'm gonna go after my goals. Like, that's what I'm gonna do in the workout room. And it translates into different areas of my life. So exercising for if you have high blood pressure, it is very, very significant, and it's very essential to helping your blood pressure get down. So again, the American Heart Association, they want or they encourage people to do just 5 times out the week, 30 minutes a day, moderate aerobic exercising. Again, let's go over this again. 5 times out the week, 30 minutes of workout, okay? Moderate aerobic exercising. So you ain't got to go in there and like, you don't hurt yourself. But so you don't have to go too crazy, but it's just getting your heart rate up. And so what we mean by aerobic exercising, this is actually just like walking or jogging or swimming or biking, but make it fun, make it personable. If you're a person that likes to walk, like walk with a friend, walk with a family member. I remember I used to walk with my baby in the his little carriage or whatever. And then or you can go jogging with like a group of people. Like I know here we have so many different running groups or jogging groups and biking groups. You can do that. And now that the weather's changing, it's like springtime. It's so pretty outside, and like summertime is coming. So you can swim if you like to swim, or you can do like a swimming, like a water aerobic class. So yeah, those are just some helpful tips. Again, like I promise you, at least for me, like exercise is like awesome. Like I'm so happy for it. But also they do, American Heart Association, they do encourage people, if you can, to do out of those 5 times a week, if you can do 2 to 3 times some mild weightlifting, that'll help too. But I would encourage people, if you're doing weightlifting, to please understand the weights. Like please make sure you have a trainer or you have someone who is experienced in that realm and they know how to do weightlifting, and they can teach you that. Because one thing is, you don't want to hurt yourself. Like you don't want to go in there and lift something incorrectly, or do something, or not warm up correctly, or not cool down correctly, and you have pulled something or you have torn something. So just take baby steps. Take baby steps to where you're trying to go, and ask for help with somebody who is licensed and that understands weight training. So yeah, I really appreciate y'all. Thank you so much for spending this time again. I did try to make it short, but it don't seem like it. But thank you again. I hope y'all have a blessed day, and I pray that God blesses you all and shows you all favor. All right.